Let's talk about interdisciplinary management of hypodontia with oral surgery. Here are the key points for this case. For patients with hypodontia, oral surgery can help orthodontics manage ectopic teeth. The ability of oral surgery to reposition teeth between the jaws makes it effective for addressing hypodontia. For young people with hypodontia, oral surgery can help with prosthodontic care. The collaboration between an interdisciplinary team and the general dentist, as well as pediatric dentistry, restorative dentistry, orthodontics, and oral surgery. So, what is hypodontia? Hypodontia is the absence of one or more teeth during development, excluding the third molars. For the patient's information, name Pedro Pinduco, date of birth September 3, 2008, living in Magikay, Juan Street, Cebu City, with the age of 15, height 5'6", weight of 49 kilograms, and with his other information. The patient's chief complaint in verbatim, Doc, kulang-kulang lagi akong mga ngipon. Wala pa man natubuan sukat-sukat. Unsa ka ang possible nga problema ani? For the initial examination findings, the patient has no maxillary premolars. Suspected finding is an erupted teeth, which is called as hypodontia.
Treatment planning. The patient has two options. He can undergo with surgery to expose the missing teeth or with the use of orthodontic appliances to unerupted teeth. Surgery can quickly move teeth as well as teeth that are hard to move with other techniques. Ectopic teeth that are inappropriate for orthodontic movement can be promptly shifted by transplantation in hypodontia patients. It is possible for teeth to move back and forth between the jaws. Therefore, transplanting can be used to treat hypodontia in one jaw when extra teeth are present in the opposite jaw or on the other side of the arc. A number of teeth can be transplanted into ectopic locations. The lower second premolar is particularly useful for replacing upper front teeth. Appliances of orthodontics to be placed to the teeth that will be exposed surgically are gold chains, stainless steel ligatures, and magnets. These devices are used to be attached to the teeth when the tooth is embedded in the reflected mucosa, and it is hard to maintain satisfactory. Patent erupted channel is impossible after pack removal due to severe damage of the teeth. Collaboration. This case is collaborated with the expertise of various dental professionals, including pediatric dentistry, restorative dentistry, orthodontists, and dental surgeons. Since the patient is still an adolescent, pediatric dentist will help the patient to develop good oral health habits and will guide the parents also. Since the patient is having a hypodontia, restorative dentist can help to repair or replace the missing teeth. Dental surgeons can help the patient to expose the unerupted teeth. Lastly, orthodontists can help the patient to expose the unerupted teeth by the use of orthodontic appliances.
Procedures and techniques. Pre-treatment evaluation. Patient's name, Pedro Penduco, male, 15 years old. Chief complaint, Doc, kulang-kulang lagi akong mga ngipon, wala pa man natubuan sukad-sukad. Unsa kaha ang possible nga problem ani? Intraoral findings. No maxillary premolars present. Patient was diagnosed with hypodontia, or the lack of development of one or more teeth. Interdisciplinary approach with the patient's case will include pediatric dentistry, orthodontics, prosthodontics, and oral surgery. Procedures and techniques used to aid the patient's treatment are surgical exposure of an erupted tooth and attachment of orthodontic appliance to guide the tooth in its position back to the arch. Surgical exposure of unerupted teeth, radiograph taking, and simple excision to expose the unerupted tooth. Mucoperiosteal flap was suggested in this case. How to develop a mucoperiosteal flap? Using a number 15 blade and a number 3 blade holder, incise the soft tissue from the posterior going to the anterior. Apply one smooth continuous stroke in performing incisions, and the blade should always contact the bone. Reflection of the flap should begin at the papilla using the sharp end of the Molt-9 periosteal elevator. This is then followed by reflection of the rest of the flap by the broad end of the periosteal elevator. And lastly, once reflected, the flap should be retracted or held in place using the broad end of the number 9 Molt periosteal elevator. Selden or Minnesota retractors. These retractors should rest on sound bone and not crush any soft tissue. Attachment of orthodontic appliance to guide the tooth back in its position to the arch. Gold chains. During the procedure, the oral surgeon will make a small incision in the gum tissue to access the unerupted tooth. This will gradually pull the tooth down into its proper position. When gold chains are used, the free end of the chain may be attached to an unerupted tooth with a composite bond or simply sutured to the mucosa prior to attachment to an orthodontic appliance. In this procedure, an oral surgeon and an orthodontist will work hand in hand. Stainless steel ligatures, commonly used on patients who have orthodontic braces. Stainless steel wire ligatures are used in the same way as their elastic counterparts but provide substantially greater force between the bracket and the tooth. Magnets. According to the Indian Journal of Dentistry, magnets act as an alternative to orthodontic devices such as elastics, springs, and arch wires. Magnets are either made of samarium cobalt or neodymium iron boron that can be made to attract or repel and therefore pull or push the teeth. Magnetic devices offer an optimum and biologically safe force generating system for orthodontic tooth movement.
Now let's discuss the results and outcomes of this case's interdisciplinary treatment management, which encompasses its clinical improvements, patient satisfaction, and long-term success. Now, there are several resultant clinical improvements in the interdisciplinary management of hypodontia, specifically involving oral surgery. First is helping orthodontic treatments. At the planning stage, a combined surgical and orthodontic approach can benefit many patients. The oral surgeon can assist the orthodontist by performing tasks like surgically exposing unerupted teeth and attaching orthodontic appliances to them. Next is superseding orthodontics. Sometimes, surgery can outperform orthodontic movement in several ways. It can move teeth that are resistant to other methods and can do so quickly. Ectopic teeth, which are not suitable for traditional orthodontic movement in patients with hypodontia, can be moved rapidly through transplantation. This approach also allows teeth to be moved between jaws, making it possible to correct hypodontia in one jaw when redundant teeth are present in the other. Lastly, assisting prosthodontics. In adult patients with hypodontia, dental implants are an essential part of treatment. However, for children, implants are not typically recommended until bone growth has ceased. This is where oral surgery comes in. Surgical techniques like distraction osteogenesis and osteotomies of the maxilla or mandible may be necessary to achieve satisfactory functional and aesthetic results. Now let's talk about the patient satisfaction of this interdisciplinary management. Through interdisciplinary management of hypodontia involving oral surgery, viable alternative strategies for its treatment are being presented. Through a customized approach incorporating rapid tooth movement and enhanced aesthetic outcomes, this comprehensive treatment plan results to heightened patient satisfaction. In addition, having an oral surgeon as a part of an interdisciplinary hypodontia team guarantees timely intervention when needed the most, hence contributes to patient satisfaction. The last part of the results and outcomes is long-term success. This refers to the positive results and goals which will last for a significant amount of time that is brought about by this case's interdisciplinary management. First, we have dental implant alternatives. Surgical transplantation of teeth presents a compelling alternative to dental implants, particularly among young patients affected by hypodontia. Transplanted teeth have demonstrated commendable long-term survival rates, making them a favorable option for tooth restoration. And lastly, maintaining bone growth. Early placement of dental implants in young patients with hypodontia has demonstrated the potential to stimulate alveolar bone growth without significantly interfering with jaw development. This preservation of bone growth may simplify future jaw surgeries if required.
The outcome of this research have provided insight to the role of oral surgery in the management of children and adolescents with hypodontia. Orthodontic and prosthodontic treatment may benefit from surgical intervention. In some circumstances, surgery can replace orthodontic treatment because tooth transplantation involves jaw-to-jaw movement. The treatment plan involves surgical exposure of unerupted teeth and attachment of orthodontic appliances. Attachments that can be placed on teeth which have been surgically exposed include gold chains, stainless steel ligatures, and magnets. The interdisciplinary management of hypodontia involves the collaboration of a pediatric dentist, restorative dentist, dental surgeon, and orthodontist. The result of the comprehensive treatment plan and including an oral surgeon as part of the interdisciplinary hypodontia team is patient satisfaction. An alternative treatment is to include transplanted teeth that demonstrated commendable long-term survival rates, which made them a favorable option for tooth restoration. The stimulation of alveolar bone growth is a result of an early placement of dental implants in young patients with hypodontia. In conclusion, the treatment of the patient with hypodontia involves oral surgery. An oral surgeon's involvement in an interdisciplinary hypodontia team ensures that intervention occurs when it is most necessary. Thank you for listening.